All right.
Hi there. This is a group project by Michaela Lee, Courtney Messer, Julia Lowell, and myself, Deborah Bowden. And it's Sierra Leone, the Safe Birth Project for our international health class. Okay. So we picked Sierra Leone because it has one of the highest maternal death rates. And in fact, in 2015, 1,360 mothers died per every 100,000 live births, making Sierra Leone one of the most dangerous places to give birth. Okay. And the causes of the maternal deaths are mostly, a majority of it is due to hemorrhage. And hemorrhage comes from 2 or 3 different areas. The first one being anemia, and you can get anemia during pregnancy from having an iron deficiency in your diet mostly, and or malaria is very prevalent there. And when you get malaria, it really affects the blood count levels and you're very anemic. And it's the anemia that causes the excessive bleeding. The other way that blood loss is happening is through tearing and lacerations. And that's from excessive vaginal and perineal scarring because of the female circumcision, and also tearing during traumatic birthing experiences. And if you do happen to bleed out and get to medical facility, the chances are there's not going to be blood there to even give you a transfusion, which is what we do here in the United States. Okay. So the causes, like I said, can be, on top of the hemorrhaging, the other causes of death is obstructed or prolonged labor. And obstructed labor is caused by cephalopelvic disproportion, meaning that the pelvis is too small in relationship for the baby's head or body to pass through. The other risk factors for obstructed prolonged labors are due to maternal age, and that is anybody less than 17 or over 35 has a higher risk of having a birth obstruction. And they also found that people that were short of stature, so less than 4'9", also had a higher risk of having obstructive labor. The other problem with the causes for maternal death is the lack of access to medical care. So a majority of the women live in like rural areas where there's no clinics or any transportation to get to one. They have community birth attendants, but they're really untrained for complications. And the other vital reason, I know a lot of the husbands there may prohibit their wife from accessing care. Okay.
Okay, so what we decided to do to implement for this project is that we are going to implement prenatal and delivery kits with certified birth attendants. So the purpose for both of these kits is to prevent the hemorrhaging complications by addressing anemia during the pregnancy, and for the certified local birth attendants to provide training to screen risk mothers who may be at risk for complications. These certified specialists will then refer those mothers to healthcare facilities for their delivery. One of the reasons why these mothers are at such high risk and why Sierra Leone is one of the highest mortality rates in the world is because these women don't have access to medical care. And that a lot of these women decide to deliver their children at home because they live so far away from medical facilities. And so if their infants have complications, they are at risk of their children dying or themselves dying. And so if these specialists are certified in recognizing these complications, they can help these mothers prepare for the journey to travel to these clinics so that they can access this care ahead of time. So with these kits, they will have the tools necessary to help provide the mother with a healthy pregnancy and for the child to have a safe delivery. So within these kits, they will include paper instructions about the kit, along with delivery instructions and pre-delivery assessment risk for the mother. And they will also include prenatal supplements plus for preventative malaria treatment, and also supplies needed for childbirth. So next. So inside these prenatal kits, they're going to include the malaria medications. So the mother will be taking, will be given anti-malarial tablets that she will be required to take. It will not prevent the infection, but it will suppress the symptoms. So with an estimated of 190 million cases of malaria worldwide and 82% being in Africa, malaria is a major concern. And pregnant women are especially vulnerable, as around 10,000 mothers die and 200,000 infants die of the infection annually. So it is very important that we consider including these medications within these prenatal kits so that they have a higher chance of the women and the infants having a higher chance of them having a healthy pregnancy and delivery. So also we will be including iron supplements. These iron supplements will be provided for the mother to take daily to prevent iron deficiency. So during pregnancy, the heart works faster to support the fetus, and the heart volume increases about 30 to 50%. Mothers are in danger of becoming anemic if they do not take the appropriate amount of folic acid and iron they need. Also, they will be taking prenatal vitamins such as folic acid, vitamin D, vitamin C, thiamine, riboflavin, niacin, and vitamin B12. Next. So also within the delivery kits themselves, they will be given specific tools for the home delivery. So each kit will be supplied with the necessary tools to help aid the birthing assistant during the home delivery. They will include clamps to clamp the umbilical cord, cord ties to tie off the cord, a plastic sheet to keep the delivery area sterile, and to provide a clean surface for it, gloves to prevent blood-borne infections, gauze bandages for after-birth bleeding, disinfecting soap to clean the area to prevent infection, a sterile razor to prevent infection, a baby blanket to keep the infant warm, oxytocin and or hemabate injectable to stop the bleeding after the birth, and an instruction sheet for the delivery for the birthing assistant to refer to during the process. So next. Also within these kits, there will be provided paper instructions. So each kit will have their own personal copy of instructions that shows what is included inside, their specific uses, facts about the prenatal vitamins, and assessments to give the patient prior to delivery. So the PDF. So this is a sample. This is the PDF sample of what will be included in the PDF. So this first page right here is the sample of what are the types of tools, what is actually included itself in the delivery kit. So on the left side are all the types of supplements, and so on the right side are all the types of tools that are inside the delivery kit. So going down. So these are just the types of supplements and what and when the mother should take them. So going down the list. And this is the assessment that the mother that the delivery assistant will be asking the mother. And this is just more of the, and this is the clean and safe delivery instruction sheet to make sure that the delivery is proper and that it is safe for the mother. So, okay, so next. All right, so as part of this process, we're going to have certified birth assistants. So medical professionals will volunteer or be paid to certify birthing assistants in all the required knowledge they need to know how to help have a successful home delivery for these mothers. They will also be trained in recognizing specific complications that may require the mother to travel and seek further medical attention. and they will be recertified biannually. Okay.
All right, so there are some barriers that we run into with our project. One of those is that Sierra Leone has free health care for our children. This is a great system, but because of it, there is a lack of birth attendants. The attendants don't get paid to assist in deliveries that aren't in a hospital. Unless you work in the hospital, you won't get paid. And so this is a great system for the country, but those women that live far out or that aren't allowed to go to the hospital or just don't make it, they don't have a birth attendants that can come help them. Another barrier we run into is that many women, like mentioned before, are not allowed to go to the hospital for delivery because they can't make the distance or their husbands won't allow it. And that's one thing that even with this whole intervention, if the husbands won't allow it, we can't really do much about that. So that's one barrier that we have to keep in mind. Another one is that there are many high-risk pregnancies, as mentioned before, that can cause complications during birth, like hemorrhage or infection. And that's just something that we always have to keep in mind, because even having these kits and these birth attendants, there are still going to be serious complications that we have to consider. Some solutions that we have to these barriers is that we will offer compensation to birth attendants, as well as compensation for each delivery or things like every house visit. So they'll be able to have a job as a birth attendant. This will create jobs for many women, as well as kind of help the economy of Sierra Leone. The biggest outcome of the training of birth attendants will be birth attendants will be trained and available for women who do not deliver in the hospital, which is of maternal mortality, and the catch problems or high-risk pregnancies before they get too serious, that cure with home and self-delivery. And if they catch high-risk pregnancies, they can encourage the women to make it somehow to the hospital, or maybe help them find a way to make it to the hospital. With our clean delivery kits, we can provide assistance to women in birth and also help make the delivery as smooth as possible. As well as with the prenatal kits, we can keep them healthy during their pregnancy so that mother and baby are healthy when the baby arrives. And this will help reduce, the kits will help reduce and also increase the purpose of this intervention, pregnancies, and also healthy baby, a healthy mother and healthy baby. So there are many barriers, but we hope that with our intervention we'll be able to many of those barriers and create a more healthy mother and baby.
All right, so to implement our intervention in Sierra Leone, we would first have to divide Sierra Leone into 4 different regions to allow the birthing attendants better access to the training, and also to make sure there is a birth attendant assigned to each area within each region. The training of the birth attendants is very important because it can reduce the amount of deaths during births. The birth attendants would be trained to be prepared for complications during birth that they could help with. The birth attendants would be trained to use high screening tools, and also the birth attendants would be trained in early pregnancy appointments to be able to foresee any possible complications during birth, such as the pelvis being too small to pass the baby. This is part of the prenatal care given to the mother, and by having early pregnancy appointments, the mothers would be aware of the risks that could happen when giving birth and possibly prevent complications from happening by using different approaches. For the birthing attendants, training would also include delivery by teaching the attendants safe delivery procedures. The newborn care is also vital for the birthing attendants to be trained in to help the new mothers take care of their infants after they are born. And they would also be trained in the use of proper sterilization techniques. This could reduce the amount of infections that end up killing the mothers after giving birth. Now, the training of the birthing attendants would be a 2-day training in a central location in their region that they are split up into. The 2-day training would occur once in the beginning as an initial training, and then they would attend a 1-day recertification every year
to allow them to keep up on their certification. So in order for the birthing attendants to be compensated for their time and talents, the government needs to enforce room in their healthcare system to pay the birth attendants for each birth they do, the training, and their house visits. Our intervention would include a letter to Sierra Leone's government explaining why this could be beneficial to them, and also ideas of how they could make it happen. If the birthing attendants were being paid for their labors, they would care more about the work they do, and they would do a better job. So with the sterile birthing kits, that would be accessible to the pregnant mothers. In early pregnancy examination and training of the birthing attendants, the death rates of mothers after giving birth would decrease. And these are our references that we used for our project. All right.